Okay, so the door is shut, the curtain is pulled, the patient is in a safe and private room. My name is Alexis. I'm going to be your student nurse today.
Hi.
I'm going to begin by making sure I have all the equipment I need. I have my pen light, my stethoscope, and my gloves. Next, I'm going to perform infection control by first washing my stethoscope and then sanitizing my hands. Now, do you use any assistive devices?
No.
No? Okay. Can you state your name?
Melissa,
Where are you?
Old Orchard,
And do you know what day it is?
Tuesday.
Okay, so patient is alert and oriented ×3. Speech is clear, no slurring, it's not garbled, and patient has no difficulty forming words. Now, I'm going to give you 3 words that I want you to remember for me, and later on in the assessment, I'm going to ask you to recall those 3 words.
Okay.
So, remember banana,
Nana,
sunrise,
sunrise,
and chair.
chair.
Got them?
Yeah.
Okay. Can you smile for me? Frown? Puff out your cheeks? Raise your eyebrows? Okay, so patient's facial movements are intact, meaning cranial nerve 7 is functioning properly. Now, could you just close your eyes and tell me where you feel me touching you?
Left shin, right knee, left thigh, right arm, left shoulder, right cheek, nose.
Okay, so patient properly identifies where she's feeling the sensation in the upper extremities, lower extremities, and the face. Could you touch each finger individually to your thumb? Okay, great. So patient's fine motor skills are intact. Now, if you wouldn't mind standing up for me, please. And if you could just walk across the room heel to toe. Okay, and back on just your heels. Now just your toes. Okay, good. So patient's gait is smooth and fluid. No signs of imbalance, limping, swaying, or shuffling. Posture is erect. Now could you stand on one foot? Stand on your other foot. Can you drag your heel down your shin starting at your knee? And your other one? Okay, so patient's coordination is intact. She does not fall or sway. Now could you stand with your feet together, arms out, close your eyes, and try not to move? Okay, good. So patient passes the Romberg test with ease, meaning balance is intact. She doesn't sway or fall. Now could you put your hands over your head and lean forward like you're diving into a pool for me? I'm just going to palpate the patient's spine. Okay, so there's no palpable masses on the spine. Spine is straight in alignment, no signs of curvature, no signs of scoliosis, kyphosis, or lordosis. Was there any pain upon palpation?
No.
Okay, so patient reports no pain upon palpation of the spine. Hips and shoulders also straight in alignment, no deviation. Now I will assess the range of motion of the upper extremities. Could you circle your arm for me? Good, and your other arm. And bend your elbow. And your other elbow. And could you circle your wrists for me? Okay, so patient has full range of motion of the upper extremities. No signs of edema of the joints. No signs of crepitus. Was there any joint pain? Okay, great. Now I'll assess the strength of the upper extremities. Could you just put your arms out straight? Push up against my hands and down. Pull against my fingers. Okay, so patient strength of the upper extremities is 5 out of 5 bilaterally. Now I will assess the range of motion of the lower extremities. Could you just swing your leg forward for me and backwards and then in and out? Okay, and same thing on this side. Forward, backward, in, out. Could you bend your knee for me? And your other knee? Okay, so patient also has full range of motion of the lower extremities, no signs of edema around the joints, no signs of crepitus, any joint pain in the lower extremities? Okay, great. Now, if you could just have a seat, I'll assess the strength of the lower extremities. Okay, push up against my hands and down. Good. So patient strength was 4 out of 4 bilaterally on the lower extremities. Now if I could just see your arms and your hands. Skin of the upper extremities is pink, smooth, warm, and dry. Nails are thick and smooth, visible as pink through a transparent nail plate. No signs of cyanosis, clubbing, or cracking in the nails. Capillary refill under 3 seconds. Bilaterally, meaning adequate circulation. Skin turgor is good. No signs of tenting on either hands. Now I'm just going to take the patient's radial pulses. Okay, so radial pulses were present bilaterally, 2+ in strength. Now moving on to the head and neck. The patient's head is erect and centered on the body, appropriate shape and size for the body. Skin of the head and neck is also pink, smooth, warm, and dry. No visible lesions, no discoloration. Now I will again perform infection control by sanitizing my hands before I put my gloves on to palpate the patient's scalp. Okay. So patient's skull is hard and round, no palpable masses. Is there any pain? Okay, so no pain upon palpation of the scalp. Hair is evenly distributed, no visible lesions, no signs of critters. Hair is thick, not brittle, and dark brown in color. I'm just going to sanitize my hands once again. I'm just going to palpate the neck. Can you swallow for me? Okay, good. So trachea is midline, thyroid non-palpable, no goiters, lymph nodes non-palpable, meaning no signs of infection, and swallowing reflex was intact. Could you just raise your shoulders up against my hands? So patient has range of motion in her shoulders, meaning the spinal accessory nerve is functioning properly. Could you open and close your mouth? Good. No signs of crepitus, no signs of TMJ of the jaw. Could you touch your chin to your chest? Tilt your head back. Look to your left. Look to your right. Touch your left ear to your left shoulder. Right ear to your right shoulder. Okay, so patient has full range of motion of the neck. Facial features are symmetrical bilaterally. Now I'm just going to palpate the frontal and maxillary sinuses. Any pain or pressure? No. Okay, so patient reports no pain or pressure upon palpation of the frontal and maxillary sinuses. Now I'm going to assess the ears. Ears are appropriately lined on the sides of the patient's head, symmetrical in shape and size. Skin is pink, smooth, warm, and dry. There's no palpable masses, no visible lesions. Now I'm just going to look in there for a minute. Okay, so there's no abnormal drainage of the ears. Now I'm just going to stand on one side of you, whisper a word, ask you to repeat it back to me. Okay. Stand on the other side, whisper a different word, ask you to repeat it back to me.
Okay. Fish.
Correct.
Spoon.
Okay, so patient passes whispered test with ease in both ears. Now moving on to the eyes. Patient's eyes are almond-shaped and symmetrical. The cornea is clear, sclera is white, no signs of jaundice. Iris is dark brown. Pupils are 4 millimeters in diameter. Okay, so conjunctiva is pink in both eyes. Eyelids show no signs of edema. Eyebrows and eyelashes symmetrical and evenly distributed. Now, if you could just follow my pen for me with just your eyes, don't move your head. Okay, so patient passes cardinal fields of gaze test with ease, no signs of nystagmus. So if you could just keep looking forward and tell me when you can see my fingers out of the corner of your eyes.
Okay.
Good, so patient's peripheral vision is intact. Again, keep looking forward. I'm going to assess the patient's corneal light reflex. Okay, so patient's pupils constrict consensually upon the corneal light reflex. Now, one last thing for the eyes. Could you just follow my pen in and out? Okay, good. So patient's eyes accommodate appropriately and again constrict consensually. Moving on to the nose. Patient's nose is midline of the face, appropriate shape and size for the body. Do you have any difficulty smelling?
No.
Okay, so patient reports no difficulties with smelling. Could you just plug one nostril, breathe in, and the other one? Okay, good. So patient's nostrils are patent bilaterally. If you could just tip your head back for me and take a look. Okay, so septum is intact, not deviated. Nasal membrane is pink and moist. No abnormal drainage. No polyps present. Moving on to the mouth. Mouth is also midline of the patient's face. Appropriate shape and size for the body. Lips are pink and moist. Could you open your mouth, stick out your tongue, and say ah? Good. So uvula is midline and pink. Tonsils are intact. Tongue is also midline, pink, rough in texture and symmetrical, not deviated. Teeth, there were no missing teeth. Teeth were white, no signs of dental caries. Mucosal membrane, pink and moist, no signs of cyanosis or dehydration. Also no foul odor. Now I will take the patient's carotid pulses. Okay, so carotid pulses were present bilaterally, 2+ in strength. Now I will also take the carotid artery, first with the diaphragm of the stethoscope and then with the bell. Okay, so upon auscultation, there was no abnormal rates or rhythms heard, no swooshing sounds. Now I will inspect the precordium. If you could just sit up straight for me. Any pain or tenderness?
No.
Okay, so patient reports no pain or tenderness upon palpation of the precordium. There was no palpable flutters, no signs of heaving, and no signs of trouble breathing. Now I will listen to the patient's heart sounds. Again, first with the diaphragm and then with the bell of the stethoscope. So I'm going to start with the aortic, and the pulmonic, the second pulmonic, and the tricuspid, and the mitral. Now I'll listen again in all the same spots, just with the bell. Okay, so no abnormal rates or rhythms were heard, no swooshing sounds, S1 and S2 sounds were present, meaning the mitral and tricuspid valves were functioning properly. Moving on to the lungs. If you could just face that way, you don't have to stand up, just turn for me. Take a deep breath in and out. Okay, good. So patient has no difficulty with inspiration. Lungs expand symmetrically and bilaterally. No barreling of the chest. Now I will listen to the patient's lung sounds. If you could just take a deep breath at each new placement of the stethoscope.
Okay. So, deep breath. Good. Good.
Okay, so posterior and anterior lung sounds were present, and lung sounds were symmetrical bilaterally. No signs of bronchi, wheezing, or crackles. Can you recall the 3 words I gave to you at the beginning of the assessment?
Banana, sunrise, and chair.
Okay, good. So patient's short-term memory is intact. If you could just lie on your back with your knees bent, I'm going to listen to the abdominal and vascular sounds. Do you mind if I lift your shirt up? Okay. Okay, so bowel sounds were present in all 4 quadrants, no signs of hypo or hyperactivity. There was also no sign of an aortic aneurysm. Now I'm just going to palpate the abdomen. Could you tell me if you feel any pain or tenderness? Any pain or tenderness?
Nope.
Okay, so patient reports no pain or tenderness upon palpation of the abdomen. There were no palpable masses, no palpable distension. Skin of the abdomen was pink, smooth, warm, and dry. Now I'm going to ask you to please extend your legs out, and I'm going to continue range of motion of the lower extremities. Could you please circle your ankles for me? Good. Wiggle your toes. Okay, so no signs of edema in the joints, no signs of crepitus. Is there any joint pain?
Nope.
Okay. Toenails are thick, smooth, and visible as pink through a transparent nail plate. No signs of cyanosis, clubbing, or cracking in the nails. Capillary refill under 3 seconds bilaterally, indicating adequate circulation. Skin turgor is good. No tenting in either foot, meaning adequate hydration. I'm just going to take the posterior tibialis pulses. Okay, so posterior tibialis pulses are present bilaterally, 2+ in strength. Now the dorsal pedis pulses, which are also present bilaterally and 2+ in strength. Skin of the lower extremities is, again, pink, smooth, dry, and warm. Thank you.